Hi, welcome to Chamber Exchange, a TV show. My name's Tim Murray, President and CEO of the Worcester Regional Chamber of Commerce. And Chamber Exchange, a TV show, is an opportunity for us to bring on our chamber member businesses and organizations, their leadership, to talk about things of economic development and public policy in the region. The show is brought to you by St. Vincent Hospital and Bank Hometown. I want to jump right in because so much to cover, but really pleased to have with us Dr. Eric Dickson, who's the President and CEO of the UMass Memorial System, the largest employer in Worcester County, absolutely essential to kind of the healthcare delivery of not just Central Mass and Worcester County, but the Commonwealth. But a veteran, a graduate, a community college graduate, a Merrimack College warrior, doctor, president, CEO, a lot to jump in, but a lot of, despite the challenges that are happening right now in healthcare, and we want to get into that, some exciting things happening in the UMass Memorial System in terms of new construction, some acquisitions.
Absolutely. Yeah, a couple of great things for UMass Memorial. I mean, I think the highlight for the year has got to be Victor Ambros winning the Nobel Prize. And, it's just amazing to see that kind of science coming out of Worcester, the second Nobel Prize for the school in a couple of decades. That's pretty rare for a state public healthcare system and school to get that kind of recognition, worldwide recognition. So congratulations to Victor and the school for just what is an amazing start to the year. I think for us also bringing Milford Hospital into the healthcare system. Milford's a major teaching site for us. I rotated there as a student, as a resident. It was always everyone's favorite place to go. And that's gone extremely well. They're just a great staff and physicians and kind of culture over there. So we were thrilled to bring them in. And then opening up the new tower, the pavilion over on the university campus. Desperately needed some additional beds, get patients out of the emergency department. And to see the emergency department start to flow again, especially as an ER doc, was really great to see. So there's definitely some good things going on. And it's been a busy year, and I'm sure next year will be even busier, but we're happy with where we're at right now today.
Yeah, and also, leadership of the UMass Memorial System in the midst of the whole kind of steward healthcare crisis. UMass Memorial kind of stepped in working with state leadership, elected business leaders as well.
Yeah, it's one of those things that you didn't have on your strategic plan, or you didn't think that you were going to have to do. But when the SHOBA closed ultimately, and we saw the kind of volume that was hitting the other emergency departments and the wait times for people to be picked up by an ambulance and the turnaround times for the ambulances regionally, it was a disaster waiting to happen. So it worked with the state and the governor to come up with a plan that could support that region. And so we'll be building a standalone emergency facility in Groton. It'll take a little bit to get it up and running, and we'll try to do the best we can in terms of stabilizing EMS in the region until then. But there's always something going on.
Right, and probably better than most how important it is as a ED doc yourself, right?
Yeah, it's the system really. When you say when does it really fail, and people all agree it fails, when you call an ambulance and nobody comes, or it takes an hour for a 911 response. And that's the kind of thing you can see if it takes too long to turn an ambulance around at an ER because it's too busy, or if there is no ER to take them to and you have to drive 30 minutes, then especially for the smaller towns, they only have one or two rigs available. And so they were feeling that, and they're still feeling it up in that region, and we're trying to support them as best we can. Moved a helicopter up to Fitchburg to give them another resource, and we'll see if we can get a little bit closer. But it'll take a couple of years before it's stabilized up there, but I think we got a good plan.
Mm-hmm. And speaking of plans, Marlborough Hospital.
Marlborough Hospital, what we call our Eastern Front, and it's about as far as we go now. It's an area of the state that's really growing. There's been incredible demand for services out there. What we'd like to do, and we've applied to the state to do, is really build up the cancer center out there and be the second healthcare system in New England to bring proton therapy, a very advanced radiation oncology therapy to the region. But we're also going to work to build up the emergency department and hopefully eventually get some extra beds out there, because they're just so busy out there. And it seems like that's the area of growth for us the most in that kind of eastern Metro West, just on the edge of Worcester County.
Mm-hmm. As I mentioned when we started the show, a lot of challenges in healthcare right now. It's being talked about nationally, certainly here in the Commonwealth. Some of that is exacerbated because of the responsibility that UMass Memorial has taken on in being a safety net hospital. Those who might not have insurance, or those who have insurance that doesn't pay necessarily dollar for dollar for the cost of care, and you're trying to be proactive, engaged in that debate. Where are we, as we stand right now, and what's the path forward?
Yeah, it's a challenge if you have a high Medicaid percentage or a high uninsured percentage, or Mass Health Limited, which is kind of a migrant insurance for any healthcare system. And you can't cover the cost for the care that you're delivering, and the more care you deliver, the more money you lose on that kind of book of business. And for us, we're always trying to figure out how you're going to balance between what you charge on the commercial side to make sure that you can still care for the people basically living in poverty, because it's a poverty standard to get on a Medicaid. Because if we charge too much on the commercial side, then I'm putting pressure on businesses that that are struggling to pay for the health insurance for their employees. Our 20,000 employees included, it's one of my biggest expenses is health insurance for our own employees. So we're constantly trying to balance that, try to leverage some federal dollars where we can to get some Medicaid match. We've done some things in and around provider assessments that you hear talked about, to a little bit of a Robin Hood, steal from the rich and give to the poor. So if the hospitals with a small percentage of Medicaid can kick in to then help out the high Medicaid percentage hospitals, it kind of balances the overall ecosystem. But it is the great challenge that keeps on getting more difficult over time, in part because of the aging of the population. And so the most of us have commercial insurance through our employee, and that's our best payer. You've got an aging of the population, and the commercial percentage goes down for everyone. And so you've got your governmental payers where you lose money, and then you can try to make that up on the commercial, but it's getting harder and harder because every year we go up 1% governmental. So for us, we're trying to work with the state, give them the best advice we can, try to stabilize the safety net, because in the end, if the patients are going to eventually get seen, I like to say. Whether it be, if you can't get into primary care, you're going to wait and delay, and you're going to get sicker, and you're going to end up in the emergency department. And whether you're insured or not, you're going to end up in the emergency department. And that's the most expensive place to deliver care. So really working with the state and helping people understand we need a robust primary care base. We need to stabilize the safety net, because ultimately it's going to save you money, not cost you money.
Yeah, we just have a couple of minutes left, and on that point, you've also kind of launched an initiative which I think there's a lot of interest, and it's kind of in some ways going back to the future, but healthcare in the home.
Yeah, it's as you think about the aging of the population, we need to find more efficient ways to deliver care to patients. And probably the most efficient way we found, and it actually turns out the quality is better, is to send a paramedic into the home to see a patient, to have the physician remote in. The paramedic can do an IV, medications, fluid if they need. They can do labs from the point of care testing. And they can put them on a remote monitor, and I can see the telemetry strip, the EKG on the patient from my office. And you do these visits, and often we don't have to transport the patient to the emergency department. And so I think the exciting part about medicine is that if we can start to bring some more of this innovative, less costly things into place, things that don't depend on the legacy bricks and mortar is what I call the hospital now, push more care in the home, we can fix this thing. We can improve access, and we can improve the health of the people here in Central Mass. And I'm incredibly proud that some of that innovation, is probably, we're top in the country for that. And so that's where we want to be. That's where we're going. And, tune in to see where it ends up.
Yeah, well, we'll have you back to see report on that. But just really grateful for the work that you and your team and the 20,000 employees do on a regular basis to keep so many people in the Commonwealth and Worcester County healthy, and obviously a major employer in the region. So as a chamber, we appreciate that. So Dr. Dickson, thanks for being with us.
Thanks a lot, Tim, and God bless all the healthcare workers out there.
These days, you've got your hands full in life. That's why we help you bank simply and securely with tools like Face ID and Touch ID. It's why we make it easy to make purchases on the go and get cash back while you're at it. Why we help you quickly deposit checks wherever you are. And it's why we lend a hand with sending and receiving money right from your phone. So even when you're on the move, you can manage your finances. Bank Hometown. Unlock your potential.
Hi, my name is Tim Murray, President and CEO of the Worcester Regional Chamber of Commerce and former Lieutenant Governor of Massachusetts. You know, one of the great stories in public education today has been the success of our vocational technical high schools and Chapter 74 programs. Why? Those programs at our high schools not only have our students graduating with a high school diploma, but an industry-recognized credential that prepares them for the world of work. We need more vocational technical high school for all of our students. Unfortunately, Governor Healy has put a short-sighted proposal forward that would create a lottery system, unproven, that would determine how students get into our voc tech programs. And unfortunately, that also pits students against students in our urban, suburban, and rural communities. So we're asking you to help us take action. Say no to Governor Healy's short-sighted proposal and say yes to universal access to vocational technical high schools and Chapter 74 programs. Please go to mavoctechcoalition.org to learn how you can help us by calling your state rep, your state senator, emailing them, and letting them know that we need to have universal access for our Chapter 74 vocational technical programs for all of our kids, no matter where they are in the state.